What's actually in a vape, and why are so many kids addicted to them? It's a question more and more young people, parents, and educators are asking as vape usage continues to rise, and so do the risks. Today, I'm talking with Dr. Michelle Peace, a forensic toxicologist and professor at VCU, whose research has been at the forefront of uncovering what's inside these devices, how the technology has evolved, and why the vaping epidemic is so much bigger than we think. We talk about how the science points to an urgent need for better data, not just to shape policy, but to get clear evidence based information into communities and schools so that kids can make healthier choices without shame, stigma, or the confusion. Because using science to tell the truth is the first step to understanding what's going on and how we can change it. Let's get into it. We're meeting with real leaders shaping a healthier future for our young people. We dig into what motivates them and how their work makes a difference. I'm CJ Sturmer, and this is the Champions for Youth podcast. Hi, Michelle. Thank you so much for joining me today.
Of course. I'm excited to be here with you and have the opportunity to talk about what's coming out of my research lab. I am a professor in the Department of Forensic Science at Virginia Commonwealth University. I am a forensic toxicologist. I used to be a practitioner, but I decided to return to university so that I could mentor young people and start a research program. One of the things that I thought a lot about when returning to academia was, that we have to figure out how to tell better stories, right? So find a story that empowers somebody to make a decision about that information. And so one of the things that I do with myself, and also I train my research team, is how do we talk about really hard science in a way that empowers a non-scientist or a community stakeholder or a parent or a legislator, that they can make good decisions about policy or practice. So we spend a lot of time working on that.
Michelle, you are a longtime researcher at VCU. You've done a lot of work looking into vapes and e-cigarettes. I'm kind of curious, what motivated you to start looking into vapes so early on, especially considering that people weren't really paying attention to these things?
I appreciate that question because as scientists, we can't work in silos. So I had a student who in about 2011, 2012 had been studying abroad, and she comes back to VCU. She just says, "Hey, doc, you really need to look at these things called vapes." I was like, I don't know what those are. And, and so you have to think about, they're so common in our culture today that at some point we didn't culturally understand what these things were. And so in about 2011, 2012, that's where we were. I told her, I was like, I don't know why I would be interested in how somebody consumes nicotine, which is a legal drug. Why I'm a forensic toxicologist. I don't know why I should care about that. But I got to thinking about it, and it dawned on me that if people were able to manipulate the device or open up the device, that they were going to be able to put other drugs in it besides nicotine. We don't know how e-cigarettes work. We don't know if it's going to facilitate overdoses. We don't know that it's going to facilitate addiction. And, I just felt like that was a really slippery slope. And so we pitched an idea to the National Institute of Justice that we really needed to study the impact of e-cigarettes on drug usage.
That's a really unique perspective. And it's interesting how you were really able to connect those dots outside of this silo to create this really simple hypothesis on what we think is really happening.
Yeah, we have to figure out how to be predictive in a lot of ways. And the only ways that as communities, where we're never going to be able to keep up with, but it's only through working with maybe unusual stakeholders or parts of the community that you're not used to working with, that people hold different data points or pieces of information that can make what you're doing or what I'm doing more powerful or more meaningful, or if somebody else has already thought about a solution to something. So reaching out to your community and listening to the community, I think helps us be better caretakers.
That's such a great point. We can accomplish so much more if we work with others that think differently than us. We have to get out of our silos, right? There are so many people with similar goals. So we're starting to see these vapes show up in the United States, and you had this aha moment and really became one of the early adopters of this research, to say. What are these vapes things? What exactly was it that you were finding?
Vapes came into the United States probably last. So they had made their way, through Asia and Europe and Australia before they really came to the United States. So they were introduced through a tobacco expo in about 2006 or 2007. And I think they won an innovation award, and reasonably so, because the technology of vapes is actually really cool and very useful. There are research teams that are trying to figure out how do you use the technology to take prescription medication, right? So the technology is really cool. When we're sort of like in the early 2010s, the vape device, the e-cigarette device, is pretty boutiquey. It is with small manufacturers and startup companies, and they're able to tell essentially whatever narrative they want about vaping. And so there was a lot of mythology came out in those early days. So not really understanding what they were, I asked around to a bunch of my colleagues in crime labs and asked them, are you receiving any e-cigarette vaping, devices in as evidence? To be analyzed. So there was one lab I reached out to, and I said, any chance at all that the police are submitting these devices for analysis? And he goes, yeah, but we don't know what to do with them. We don't know how to open them. We don't know how to analyze the liquid on the inside. So they're not central to the cases. So we've just been collecting them. I was like, okay, we're going to help you open them up. I'm going to tell you how to do it. So he comes back to me a couple of weeks later and he goes, they had pot in them. And I was like, I knew it.
Wow, that's such innovative thinking, especially, you're just asking a simple question. And it seems you saw similar rapid growth that I think we all saw in the vaping industry. This surge in not only their presence, but the different evolution of that vaping technology. And based on this research that you've conducted and the outcomes of that research, how did it get here? How did this happen so fast?
If you can get a drug into liquid form, and there's a way to do that, then you can get that drug into your vape. And so that's what we saw in the early days. So what we saw then was that the technology changed to facilitate this. So there was a generation of devices that was invented expressly for the purpose of vaping drugs other than nicotine. So we were really quick. Once we saw them emerge, we were really quick to publish on these. This is sort of the mess of what happens when we have an unregulated industry. Regulations are meant to support, public health and public safety. And when you don't have good regulations, then there's going to be gaps in quality assurance. Mythology is going to develop. One of the things that we understood in those early days was the industry was completely unregulated up until 2016. Now, the FDA's regulations that they had in place did not include vaping technology. So then they had to spend several years, one, they had to be directed by Congress and President Obama to actually change the regulations. So that took time. And then they had to write those regulations and sort of vet those. So that took time. And, what's happening there while we're still trying to figure out how to regulate these is that the industry is going to expand. You could be a 9-year-old and legally purchase a vape. The states then were individually responsible for banning them to children, putting restrictions in restaurants and public places for vaping, right? So it took a while. We take for granted that we are a culture of tinkering. We are a culture of innovation. So, this is when there's no regulation and this culture of tinkering, and people wanted to be able to leverage this technology for other things. So that empowered them to figure out how to do that.
When did we really start seeing these vapes pop up in schools? I don't think a lot of us were really paying that much attention and really waking up to what was actually happening in the communities, how this was actually affecting teenagers and people in schools, and how is this new technology evolving in schools? Because that must have been so frustrating.
Yeah, so we started getting in cases and questions into the lab, which was about kids and getting access, right? And so this is part of what really began to drive me towards I've got to figure out how to get data faster to school systems. So I had a school system reach out, and, right, because I'm known as the woman who talks about adulterating vapes. And they reached out and said, hey, we think the kids in the school system, we think they're putting cocaine into their vapes. I'm like, what? Okay, so let's pause and unpack that. Why do you think that? So what the school didn't understand was that there was a new device in town, right? It was a pod style device that could easily be mistaken for other things like ink pens and highlight markers. And when I met with the school system and I realized that there's so many of these in the schools, I told them because of these pod style devices can contain more nicotine, that these kids were experiencing nicotine toxicity. That's not cocaine. Whatever it is that you're collecting on school grounds, why don't you just send those to me for analysis? I'm a chemist. This is what I do. And so they did. And we were able to start tracking the chemical composition of these products. So we just started thinking a lot about kids having access to these and listening to the mythology that is developing around vapes from they're safe to use, or it's just water vapor.
Was that just nicotine, or were they evolving even more into something else?
So we start presenting this data about nicotine and what's in these vapes. And we saw that the biggest chemical change was they were putting a synthetic cooling agent in there because there was a ban on menthol. So they just started using this chemical called WS3 and WS23, which is a synthetic cooling agent that was essentially invented in the 50s to put in things like shaving cream, not just shaving cream, but other kinds of healthcare products for that cooling sensation. And so now they're putting that into the vapes being held. So I'm aggravated enough over that, and that, kids have easy access to them, and parents don't know the difference. Teachers don't know the difference. We're talking about, how easy these things are to hide, and, kids are becoming addicted to them quite easily. And so a colleague of mine was presenting the data in one school system, and she was like, oh, the teachers are they wish it was nicotine now, because now all the kids are vaping pot. And I was like, okay, again, why? Why do we think that? We met with some teachers and they all said the same thing, that all the kids are smoking pot. And I am so enraged, right? Because it's like time got away from us and the industry charged ahead, right? And one of the things that was happening the very next day was a meeting of Virginia's Cannabis Control Authority. And I wasn't on the docket. And so I just go to make a comment. And I am so angry over now there's a perception that all the kids are vaping pot now. Like, how did we get here? And so I was so enraged when I got up to speak to them about what was being said in the schools. I'm not kidding. I was crying. I'm just right. That's my stress response, is either to laugh or to cry. And so, right. And so I just shame. It's just shame on all of us, because, while we're worried about all of these other things, and I had this narrative of, we've got to do something to be more aggressive about protecting children and protecting our schools and protecting our communities. And now it's gotten away from us. And look at all of this unregulated cannabis, and kids have access to it. We knew this was going to happen. And so there was somebody from the Virginia Foundation for Healthy Youth was in the audience and sort of heard my plea for, we have to do something. I can't be in a silo to be angry about this by myself. And so the Virginia Foundation for Healthy Youth came forward and funded a pilot project for us. And so one of the things that we feel very strongly about is you can't manage something unless you're measuring it. And you can't develop good policy or good education unless you really know what's in your school, what's in your system, what's in your community.
Wow, yeah, I love that emotion, and I totally agree. I felt like it just got away from us too. But what I love is that you charged ahead. You said, "I got to speak up. I have to do something." And I like what you said, that before we take action, we have to really understand the issue, right? Like we have to get some basic understanding about what is really happening and be able to make data informed decisions so that we can actually create effective change. That it has to be really intentional, right?
Right.
So I'm really curious, how were you able to do that? How were you able to start developing what a solution actually looks like to get this information in schools? How are we getting it there?
Yeah. So one of the things that we committed to, and there's a lot of navigation in this, when you decide that you're going to be a response mechanism for somebody to make decisions really close to an event, you've got to put resources on that. And so one of the things that me and my team felt very strongly about was we have to get the devices in, collect all kinds of data about them, from what do they look like to analyzing them, what's the chemicals. And we try to push out quarterly bulletins. They're not pretty, right? But they're very data driven. Here's exactly what we found. This is what came out of this health district. These came out of this health district. And these are all the chemicals that we found. They're very dry. We don't make any kind of assertions about it. We don't interpret it. We just here's all the data. And so a handful of things unexpected fell out of that because we're in such new territory here. We don't know how to leverage all of this. We're learning as we go. We're having lots of conversations with school systems and parents and PTAs and administrators. And so what we heard from a couple of school systems was that the single most effective tool they had to get the kids in their school to commit to stopping vaping were our bulletins. It's just data, right? Non-judgmental. You get to decide the good and the bad and the ugly, right? When you see formaldehyde on there, people are like, formaldehyde or fingernail polish remover, or you see what I'm saying? That people will make a decision. I shouldn't be inhaling that every 10 minutes, So that was one outcome that we were a little bit surprised about because we kind of went in with no expectations, that we were just about pushing data out so that people could know what was going on in their communities. And then we had one school system that responded to us when we're trying to talk about what do we need to do with the data? How can we help you more? What kind of education do you need? So one school system came to us and said, hey, our county administrators are funding another substance use treatment and education person for the school system, right? Because A, they see the problem, but also B, now we've got data that's demonstrating that it's not just nicotine, it's also these other drugs. So, right. So those are some really cool outcomes. We funded a couple of I call them nano grants because it was only $500, $1,000 to a couple of schools, right? Where we said, we want a student-led initiative around getting kids to stop vaping. And so in one school system, we funded a yoga program, to help them. And then we had another school system needed some money to help build flyers. First and foremost is we publish in the peer-reviewed scientific literature because that is the pinnacle of scientific communication, right? It gets vetted, it gets evaluated. Is it legitimate? So there's peer scientists that are looking at this hey, is peace off her rocker when she says this? So, right. So that's always the pinnacle, right? Everything we do, we publish in the peer-reviewed scientific literature because we want to demonstrate that vetting of our conclusions. But then after that, we present at all kinds of conferences, from nursing conferences, public healthcare professionals, to substance use treatment groups. But then every school district who volunteers to participate, they get these bulletins. We have this internal folder on a server that all the schools get access to. But, the real piece that we do struggle with for our dissemination is casting it more broadly. So doing things like this is really critical because we do see other groups spend a lot of energy and a lot of time and oftentimes a lot of expense trying to, stand some kind of program or system up. And we're like, let me send you a folder. Like, let me send you how to do this. Here's what worked. Here's what didn't work and why. So that somebody else is learning off of our mistakes and out of our conversations. And so we do think a lot about how do we have a more national conversation around this, because sort of like the engine that we have. And so the secret sauce of our entire program is that I'm a forensic toxicologist who chases the unknown. I have methods that are meant to chase the unknown. I have a team trained in asking questions to chase the unknown. And so, right, and then we just build the architecture around that core to say, okay, here's how we're going to get devices, and we got to support the schools, and we got to lower the barrier for them to participate. And we also have to eliminate fear. Like, a lot of school systems have a lot of concern about participating with us. So we have an IRB so that no school gets named, no administrator gets named. You have no idea to get this back, how to put this back on a kid. But the information that we push out, we hope, is empowering and accessible to somebody who wants to make a policy or practice change.
Right. We really have to build that trust so people know your methods. We're not just making it up to try and solve for something. You mentioned a lot of this information was focused at a local level, especially in your state. Do you ever see pushback from other states or other people when they're trying to use this information in their own local places around the country?
Yeah. One of the pieces that I deal with, like, I've got confidence in the data that we produce. And one of the criticisms, though, that we get one of the criticisms that we get sometimes when I'm presenting in front of general audiences is that, oh, well, that's just Virginia. Like, I know that that is just trying to strike out against a really solid program that has really solid data that's demonstrating what is in schools at the end of the day. I think in order for us to empower community, because it is so easy to dismiss our data. Like, if you're in Kansas and you're saying, oh, well, I'm going to take that Virginia data and apply it to my community, you will have people push back, right? To say, that's not here in Kansas. We have seen that historically happen for decades, where if you're not demonstrating it in your community, then people will not want to overlay data from another community onto it. So one of the things that we would love to happen is for communities to reach out to us and say, hey, we have this problem. Hey, we want to collect data. Hey, we might not be able to do it in the scale that you're currently doing it. But if I'm a school system and I've got a school administrator who's just angry enough over this and needs some data out of their school system, then we can have conversations about, one, how do you fund that? And two, how can we help you do that? Because we have the architecture, right? And it can overlay into other communities.
Exactly. We want to get this information and we want to get these programs out in other areas, but we need to get through the pushback to help support getting through those barriers and to help take action on the actual solution, which I think a lot of people agree that we need. We talk a lot about empowering others and to ask for help here. And it sounds like that's what you're doing. You're asking for help. So, what can we do? How can we actually help to get this information along?
One of my asks is, I think all the time about how do I get other groups, other agencies, other communities, other schools in other parts of our country to say, oh, I might have access to a little pocket of money that, Peace and her team can set up the architecture here, and I can get some data so that we can make a policy change based on data of our school or our community.
Yes, help us help you to help others. We love unique partnerships here. How do we go about reaching you to provide that help? How do we help empower our community to replicate the structure and the success that you have?
So I am fortunately pretty easy to find. Just put my name and DCU into the search bar, and I'm pretty easy to find that way. You can email me directly, and we'll have a conversation about what that can actually look like. And we are in several conversations with other states right now in terms of helping them, one, understand what the program is and the kind of data that they'll get from it, but also like what are some really clever ways that you can think about how do you fund this so that you can collect enough data to make a point. I mean, it goes back to the original, like one of the very first things we said at the top of our hour, which was you cannot continue to work in a silo. And that silo can be just amongst educators or just inside of your school system or just inside of your county. You do have to figure out as a community, how do you reach out to different stakeholders with different perspectives outside of that education? And, that can bring more context to one, your problem, but definitely to your solution.
Just absolutely amazing. I am in awe. Everyone, reach out to Dr. Michelle Peace and her team at VCU. Don't reinvent the wheel. Michelle, thank you so much for the work that you've been doing for quite some time now to figure out what's happening with these vapes, to track this evolution, and to help provide us with real data about what's going on and how we can empower others to do the same that you're doing and get this same information collected so that we can do something with that. And thank you so much for your time today. I really appreciate this. Was truly an informative and great conversation.
Yeah, no, of course. No, thank you for the conversation. It's been fun, but most importantly, I appreciate that we're able to talk about this on a bigger platform.
A huge thank you to the Virginia Foundation for Healthy Youth and Prevention Connections for their support, and thanks to Mauricio Reyes for creating that great music score. Don't forget to share this with others because the only way we can make real change is if we do it together. And hey, if you like today's conversation, go ahead and give us that 5-star review. Now go out there, everybody, go do good. Thanks for listening. We'll see you next time.